So you asked me if there's things in people's control that can help that are backed by science. That was the critical thing. Backed by science are the things we're doing. So backed by science is what the standard of care is today. There's hints of stuff. Say there was a study in England, I believe it was at the last SNO meeting or the one before, using some cannabis derivative. Okay, well, the people that got that did a little better than those that didn't, and it looked kind of interesting, and they're carrying that forward and going to study it further. So we'll get some more information on that. I mean, is that backed by science? Yeah, sort of, but it's not, we don't have enough numbers yet. It's sort of early days on that. I wouldn't expect it to be a grand slam home run, but it might be helpful at some point in time. And people ask me about CBD oil, which is kind of related to the cannabis stuff, and I give them that feedback. I've gotten off track. You asked me, what's supported by science? Well, I can give them sort of common sense stuff. I always tell people, you probably ought to be eating like your mama told you to eat. Eat your vegetables and lay off the Snickers bars. That's not going to help you much. Don't go get a bucketed fried chicken tonight. It's probably not going to help you too much. One thing that's really relevant for people with a brain tumor is they need to stay hydrated. So people with brain tumors tend to get blood clots in their legs. It happens in somewhere between 30 and 60% of patients. So blood clots in the legs can go to the lungs, pulmonary embolism, and you can die from that. And of course, a blood clot in the leg is a pain in the leg to deal with. You have to take blood thinners or get a filter put in your inferior vena cava, and that's all just a real pain in the neck. So in order to help prevent those sorts of things from happening, people should stay as active as possible within safety parameters, and also don't get dehydrated and move around. So if your legs are just sitting like this all day long, you're more likely to get a blood clot. And also if this side's not working as well as that side. So that's kind of a real common sense thing, but it's true. But I can't say that there's a science. There's no study to say move around more than you used to not get a blood clot. It's just sort of common sense stuff.